Hey everybody, Caleb here. I am making my third video. I've gone to, let's see, two therapy appointments since the last video that I made. And that was basically just to kind of recap the first visit. And so far it's going really well. The therapist is you know, pretty informed, pretty knowledgeable guy, easy to talk to. Um, he has already approved me or given me verbal approval that he will write a letter for me for uh, hormone replacement therapy. I just have to find a place to go. Um, I started looking like before I even started to see him, just to see, you know, as far as the process. You go to therapy, you find an endocrinologist, you get your blood work done, you have a primary care provider, and you get all of the labs and things, and to make sure that's okay for you to take tea. So I wanted to get those things lined up, and I had already started looking through to see what was out there or what resources I had available in my area. The first endo that I called was on Laura's list as a resource for trans men. She's not taking any new patients. I was really bummed because I was looking forward to going to someone who was, on one of these lists that I wouldn't have to feel uncomfortable about going, explaining what I wanted. She's not taking new patients, but when I called, I kind of got caught up. The woman's like, well, she's not the provider that I was calling for. She's like, he's not the only person who does endocrinology here. We have other doctors. And I was so hesitant to want to explain, well, wait, I just want you to understand that what I'm calling for, I have a letter through my therapist, and she's like, do you have a primary care provider? Is he providing you with a referral? And I'm like, not exactly. So I think she really still didn't get what I was saying. And she referred me to someone, and in my due diligence, I like to call, I like to double check, I like to check back. I called this doctor and I said, hey, I just got an appointment scheduled to come and see you before I have my therapist write the letter. I just want to verify that you do this type of therapy. And lo and behold, he's like, no, I don't do that, but I know someone who does. So he referred me somewhere else, and I've been calling there and not really getting any response. It's an automated number through GW Hospital, and nobody's calling me back. So my other resource is to go to Whitman Walker Clinic here in DC. They have lots of excellent HIV/AIDS transgender services. I look them up. They accept my insurance, no problem. I don't have to see an endo. I can see any of their primary care providers are capable of prescribing tea, and even when I called this morning, she totally knew what I was talking about. So I felt a certain degree of comfort. The only drawback to this is that it's going to be, excuse me, it's going to be like a month before I can be seen. And that seems like kind of like a long time. I don't know if I have the patience to. I have it. I do. I absolutely have the patience, but I know I'm gonna get super anxious, and I'm already nervous about it. So, I will have, one thing to take my mind off of it will be the fact that I'll be healing from my reduction surgery. As you see, I don't know if you probably can't see. Goes down big. Yeah, they're big, so I'll stand up. You can see. I was checking out my profile a while ago when I was walking by the camera, and I was like, wow, you've got a nice profile, but, then there's all of that up there. There's, it's double, triple D, a little gut down here, but we're working on that. We're going to the gym shortly. But yeah, that's all me. So, I have the curse. It's a family thing. Big ass titties. And I'm over them. So this is more like Probably the biggest part of my dysphoria is my breasts, but I'm not really ready to say peace out to them. I'm not ready to say goodbye. I'm not ready to be like, okay, I'm gonna go like straight away to male chest, because that requires me to conform on a lot of levels that I don't think I'm ready for yet. So, this is medical here. I mean, as far as working out, as far as fitness, as far as getting more fit, losing weight, it is such a hindrance to have to put on 2 bras, to have to deal with the rubbing, to have to deal with, it might look like I have like large traps here. It's not. It's where my straps, like, I don't know if that's ever gonna go away. That would be kind of weird. But I consulted with Dr. Garamoni in Sunrise, Florida, to make sure that it was possible to have your top surgery after having a breast reduction. He said absolutely that it was. There were only a few extra risks involved, that being where the surgeon makes the incisions to do your breast reduction can kind of have an effect on the placement of your scarring or placement of your incisions for your chest, and nipple placement. He did mention that, where the nipples are placed. Couple things. He says totally not impossible to do that. It's, it does happen, and it is a doable situation. So I just wanted to verify that before I went through with the breast reduction, and then found out after the fact that I couldn't have top surgery later on down the road should I choose to go that route. So that's basically what's up. My therapist is pretty cool. He's just like a guide, and like the last couple visits, part of the visit has been to do the ink blot test and all the psychological evaluations. But when we're not talking about the standard stuff that he has to do to evaluate me, we do talk about the process, the plan, what plans I have. And I really like that, because I'm kind of a pragmatic person. I like things to be planned. I like to have a plan of attack. You approach a situation, and then you find out what you're going to do to work it to your advantage. So that's where I'm at. I'm going to go to the Whitman Walker Clinic now, actually, and fill out the paperwork so I can get that started. And I'll continue to try to persist with this, I think it's Dr. Joshua Cohen at GW Hospital, trying to get in a call to him. He's an endo, and see if I can get something sooner with him. So whichever one comes up first. But I tell you, I felt the most comfort when I was talking to the woman on the phone this morning with Whitman Walker Clinic. I felt totally comfortable, and once I told her what it was for, she was like, oh, well, you don't need this. You just need this, and you can see one of my primary cares, and he can do all your blood work, and he can do this, and you'll be all set. And I was like, okay. She's like, just come down, fill out your paperwork. She's like, you have Blue Cross. She's like, as long as it's a PPO, is that what you have? Because that's the only one we accept. She's like, you'll be cool. She's like, we have the pharmacy right here. It's all inclusive. It's all one-shot deal. So I'm pleased with that. So, we'll see how it goes. I'll probably continue to see the therapist on up through after, I don't know, I have my reduction schedule for not this Monday coming, but the following Monday. I'll probably make some videos as I'm recovering while I'm doped up, just to kind of talk about what I'm thinking, since I will have the entire week off. I mean, it will be time that I can spend. But yeah, so I'll keep you updated.